Vanessa, today we're going to be doing just a quick assessment of, and we're going to go from head to toe, right? And beginning with Vanessa, what I want to do is I'm going to walk you over to the scale. I'm going to get a weight and height, and we're going to do your BMI, all right? Or your body mass index, BMI. Okay, so I'm going to start here. Excuse me. And I'm going to, how much do you weigh?
170. Not 200, that was a couple years back. Funny.
I split it back. Okay, all right. Okay, so we're right around 176, so she's, all right, cool. So I've got her at 175 3/4, all right? So I'm gonna have you step off. Turn around. Make sure that your white handle here is straight up and down, all right? And for those of you who are short, I've got a step stool, so if you have somebody short, tall like Isaiah, and you're short, then we'll do that. She is 63 and a half. It's okay if you guys go on and round that off to 63 or 64, okay? All right, so she is 63 and a half inches. BMI, I have to multiply our square, my height in inches, and divide that into my pounds, all right? So height in inches was 63, and I'm going to multiply that by itself because we don't have a square button on here. And that comes down to 39.69, so I have to remember that. 39.69, and she was 175 3/4, so I'm going to put her at 175 divided by 39.69, and that gives me, then I multiply that times 700. And her BMI, yes, that's what it is. Okay? All right? That's what it is. So you'll come up with a BMI, all right?
What's the BMI?
That's what it is.
It is what it is, right?
It is what it is. All right.
All right, I'm in the obese class, okay? I know that I've lost weight. Thank you.
Always put your scale back to 0, okay? All right, Vanessa. Now, remember, I have assessed her gait. So I've already done some of her neuro, and I've already done some of her musculoskeletal as she walked over to the scale, all right? So I've assessed her gait. Now, Vanessa, what I'm going to do, I'm going to take your glasses off, okay? And I'm going to start with my face, my head, my face, my ears, my eyes, my mouth. I'm going to try to get as much of those things done that are on my form as I can. So I'm going to just start by inspecting. I'm looking at the contour of her face, her eyebrows, looking at her nose. Her nose is symmetrical, but it's midline, all right. Her eyes are symmetrical. Her mouth, her lips are dry, a little bit dry, but not cracked. Okay, pink in color. Her skin is pink coloration. I want to just now start just palpating her skin. Okay, I've got the skin. A little bit moist, palms a little bit more than the rest. I'm palpating the skin. I'm looking. Now I'm going to also do a little bit of peripheral vascular because I'm going to cut, since I got her hand, I'm going to just sort of do my capillary refills, and I don't have to hold it a little long. I just want to blanch it and see how fast they return capillary refill. Less than 2 seconds. Still a little bit moist on her skin, not really bad. Warm. I don't see any lesions. A few little moles. All right. I'm going to try to look at her back. Get her skin there, moisture there. Coloration's good. I'm going to, because you guys are going to be dressed appropriately, you can do the lower extremities, okay, and get the skin, so you get all the skin, so that when you get to like the chest and the respiratory system or the thorax, all you have to do is now is just look at the skin on the anterior and posterior chest. All right, so we've got all that. I'm gonna continue up here now. Go back up to my head and my face, and I'm going to look at my ears. I'm going to palpate my ears. Is there any different pain?
No.
Okay. And there any pain when I press there?
No.
Okay. All right. No irregularities in the ears. Speaking of pain, on a scale of 0 to 10, can you tell me what level your pain is?
0.
Thank you very much. All right. So I'm going to look there. I've done that. I'm going to do this first. I'm at my ears. I'm going to go in and do my
Lymph nodes.
Yeah, lymph nodes, thank you. So I'm doing my preauricular, my postauricular, my occipital. I'm going to come in, I'm going to do my tonsillar. I go this way because I can go backwards. Then I'm going to do my submental, my submandibular. I've already done my tonsillar. I'm going to come, I've got my posterior cervical and my superior cervicals. And I've got my supraclavicular, right? All the time I'm still palpating skin, right? All right, so now that I've done that, I'm going to ask you, I'm going to go back now and I'm going to go to the nose. I want you to do a nasal patency and just breathe for me. And out, and the other one. Okay, no difficulty, you're breathing okay? All right, no stiffness, all right, no, okay, all right. And I'm going to, now I'm going to go and do my mouth since I'm here. Maybe get gloves that are a little bit bigger for you. That way you won't struggle to get them on your hands. All right. Now I'm going to get my light here. All right. So I want just to open up. Now I'm going to do my mouth. So while I'm in my mouth, I can do my, remember I can do cranial nerves 9 and 10. All right. When I'm there in my mouth. All right. So first of all, I'm going to just look inside. I'm going to check the buccal mucosa. So open up for me. All right. Don't say that. I just want to look at the buccal mucosa. Now I'm just going to take my tongue blade and just look at the sides. It'll be nice and pink and moist. She has a little white band running along her buccal mucosa. I'm just going to look here. Look at her gums. Look at the inside of her lips, pink, moist. Gums are nice and firm. All right. Now I want to open up. All right. All right. So we're going to look up. I want you to stick your tongue out and say, ah, for me.
Ah.
Oh, nice. All right, so I've just gotten a look at her uvula. Uvula has gone up, straight up. And I've also looked at her tonsils, and her tonsils are +1. Okay? All right, so I've done that. And now I'm going to just go on, and I've got my, still in my head. I'm going to do my eyes. I'm going to do 3, 4, and 6. All right? And 3, 4, and 6 looks at eye movement. I've got my lights on, so I'm going to do my pupils equally reactive to light. So I'm going to go here. She has such wonderful eyes. If you guys want to see direct and consensual, whoever has her as a partner, look at her eyes because hers are just fantastic to look at. They're nice and clear, okay? I love it. I love it. So you get a nice, really good direct and consensual reaction on it. Okay?
Good job.
Okay. All right, thank you. All right, so now I've just done my pupils equal reactive to light, all right? So now I'm going to do accommodation, all right? And so I want you to just focus on this, and now I get my accommodation. Accommodation is when you get the convergence of your eyeballs, all right? All right, so now I've got that done. Now I'm going to go back. I would go around on the other side, but I'm going to stay on this side. I've gotten my eyes done. I've got my mouth done. I've got my ears done. I've got my skin done. I've got my lymph nodes done. Got my lymph nodes done. All right. So I've just about completed all of the top of my head. Now, I'm thinking in terms also of my other cranial nerves. All right. So if I've got to do trigeminal, I've got to test for my TMJ, right? So I'm going to test my TMJ. I want to have her move there, just open and close, side to side. All right, so now I've tested TMJ, but I'm also starting to test my trigeminal. I want you to clench your teeth. So I'm catching my masseter muscles, and I'm doing my temporal muscles, all right? So I've tested my trigeminal nerve. All right, so I want to go around now, and I'm going to do my acoustic nerve, right? And I want to have her tell me what words I say. So cover up an ear for me. And I'm going to go this.
Sorry.
All right.
Football, baseball, basketball.
Okay, and we'll do that on both sides. All right. So we're just testing the acoustic nerve. All right. Oh yes, thank you. I think Thank you for reminding me. I forgot my ocular eye movements. Okay, so I've got my 6 cardinal positions are my EOMs, and I'm going to do here, okay, here, 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 and here. Okay, thank you. Thank you for reminding me. All right, so I've done finished out my eye movements. I've done my acoustic nerve. I've done my trigeminal nerve. I want to go now. This is good. All right, making sure I remember this. I want to go back on the back side, and I'm going to start now my this. Just turn you on this bed, and now I'll go behind. I want to start my.
Do we need to do the Renee and Weber?
I'll do that in bed. Okay. I want to have you sit up. Where did I do my stethoscope?
Here.
No, I have my stethoscope. I like my stethoscope. Here.
It's the black one, right?
Yes. Here it is. Okay. All right. I'm going to start now, and I'm going to look for my chest. I'm going to do my thoracic assessment. I'm going to listen to my lungs. And so as I listen to my lungs, I want to again check my skin, look at my skin. And I'm going to, first of all, I'm going to start here before I listen. I want you to do 99. 99 for me, please.
99.
Again?
99.
Yeah.
99.
Yeah.
99.
Yeah.
99.
Okay. She has nice tactile firmness up here, and it really starts to fade right about here. Okay. One more time.
99.
Okay. And then
99.
none down there. All right. So I'm going to do my symmetrical chest expansion. Good. Now. All right. Good. Now what I want you to do is through your mouth, open your mouth, and just breathe in and out for me. I'm listening for nice, clear breath sounds through one cycle. In. Remember I told you to listen in terms of loads. Okay. So she has nice vesicular breath sounds on all loads posteriorly, all right? All right, so I'm gonna come back around the front side. And finish here. I still need to complete your hearing. Then what I'm gonna do the Weber test, and I'm gonna do the Renee test. And when I put this on top of your head, I want you to tell me if you hear equally in both ears, all right?
Yes.
Okay, good. Now what I'm going to do is this, I'm going to put the tuning fork on this phone. I want you to tell me when you can't hear anymore, and then I'm going to move it into the front of your ear, and you tell me when you can't hear anymore.
Okay. Okay.
Okay. She's at 15 and 25, okay? So that's really good. All right, so now what I'm going to do, I'm going to have her lie down for me.
Do we do it on both sides?
Save time. You know you do it on both sides, okay? But I'm having you save time. All right, so, all right, lie down for me. Now, what I want to do now is I'm going to listen to her heart, and I'm going to have her lie down and listen to her heart, all right? And versus sitting up. Because after I get through with her heart, I'm going to move down to my abdomen. All right, and that's just listen to your heart. Second intercostal space. And you guys don't have to say this when you're doing your assessment, okay?
Well, we say the valve.
You have to say the valve, all right? So, aortic. See, your heart's beating fast, kid. Pulmonic. tricuspid. Mitral. Okay, good. All right, so I have S1 and S2 heard in all four valves, okay? Precordial or whatever you say, S1 and S2 are present, no irregularities. I'm going to look at our abdomen and just pull up your... This is what
There's
you want
two.
to-
No, that's okay.
Okay.
Yeah.
All right. Now, so I'm going to look at our abdomen. I'm going to, now, when you guys do your assessment in class, if they have shorts on, just pull them down just so that you can expose the umbilicus, okay? So I'm looking at the abdomen. I'm looking at her abdomen, and I see for contour, she's flat. Yeah, so flat, okay? I'm going to come down here to try and look at her symmetry. I'm looking at the skin. I'm going to palpate the skin. I'm not going to palpate the skin because I don't palpate until last. But I'm looking at the skin. I'm going to listen. Hyperactive vowel sounds, hypoactive vowel sounds in the right upper, left upper, silent in the right lower and left lower. Okay, so I'm going to palpate now. And tell me if you have any type of tenderness when I palpate.
Doing deep or light palpation?
Light palpation only. Okay.
No pain.
No pain? Discomfort? Okay. Why don't you sit up for me? Now, one thing I forgot. When I was down here, and I said I was going to do a peripheral vascular, and I forgot to do her pulses. Okay. I'll do her pulses. I'm going to check these. Checking her radial pulses. They're equal. And they are 2+. Okay? All right. One other thing I didn't do her blood pressure and her respiration. All those we have to do in the vital signs, okay? All right, so now I've got her setting up. I've done her abdomen. I'm working my way down. All right, so I'm going to have you stand up for me. Okay? So now I want to look at, I've done my heart, I've done my abdomen, I've done my lungs, done my stomach. No, I'm going to do this right. Okay. Lie back down.
Okay. Oh.
I'm going to finish up my peripheral vascular. Now, we know we've got radial pulses, we know we have popliteal pulses, and we know we have pedal pulses, all right? So we want to palpate the pedal pulses, the dorsalis pedis. You know, you're a good model. She's got good pulses. So I've done my dorsalis, and I've done my posttibial. I'm going to check for Holman sign. I want you to plant dorsal flex. Any pain in the calf? Okay. Okay. Dorsal flex, any pain in the calf?
No.
Okay, good. All right, so we've checked our pulses. We've got our dorsalis and our posttibials. Toes are a little cool, but she's got good capillary refill in the toes, all right? All right, now this is it. Now I'm going to do my musculoskeletal. And I want to start it by just looking at the side, because what I want to do is I want to look at the curvature of the spine. There's 3 curvatures. Again, you've got your cervical curvature. It's the outie, or innie. Okay, you got your innie. You got your thoracic, it's an outward curvature. And then you have your lumbar, which is an inward curvature. You want to look at that, right? So I've done my spine, and what I want to do now is going to get motion in the spine. So I want you to just twist, right? Yeah, yeah. All right. I want you to bend laterally for me, to the side, right? And then I want you to bend forward, and I want you to just turn this way now. Just bend forward for me. No.
Oh.
Turn around. Okay, now bend. It's always important, guys, to check the. You don't have to go down so far. It's always check the spine from the back, so that if there's any curvatures, you'll be able to see them. All right. If you're from the side, it's harder to determine if there's a curvature. And then I'm just going to palpate down the spine. I'm going to look at the spinal processes. Okay. All right. And because I have her exposed, I will get her skin, the posterior side of her back. Okay. So now I've got the spine. Now we're going to start with the rest of our musculoskeletal, and I'm going to start with my neck, which is my spinal accessory number 11. So I want to have you move your neck, turn your side to side. Okay. I want your ear to your shoulder. Okay. I want you to hyperextend your neck, flex your neck. Okay. Good. Now I'm going to check the strength, and I want you to turn your head, and don't let me push it back. Good. Don't push it back. Good. I want you to shrug your shoulders and don't let me push them down. Good. All right. So now I've just checked my spinal accessories. I'm going to go down. I'm going to check my shoulders. I want you to just abduct and come up like so. So you're abducting your back, and you're adducting. You're doing internal rotation. Come up. No. Put them up. Yeah. Right up beneath your scapula, base of your scapula. So internal rotation, and I'm coming back, and I'm doing external rotation. All right. Any pain or discomfort? All right. All right. Then we can do circumflexion. Okay. All right. And then backwards. All right. And the other arm too. Okay. No pain. I didn't hear any popping. Okay. So I'm going to come and do her. I'm going to check her elbow. And we can palpate for any irregularities, but what we want to do is flexion and extension. When you're doing your joints, remember you got basically you got flexion, extension, hyperextension, okay? So remember that's okay? Flexion, extension, hyperextension. We can't hyperextend the elbow, but we can flex, we can extend, all right? Now I'm going to check the strength. Flex for me. Don't let me pull them down. I'm going to push up. Push.
Oh, push.
Yeah,
Sorry.
okay.
I didn't hear that.
Okay. So push. All right. So I've got my elbows. I've got my wrists. And my wrist, I want to just check. So I'm going to have them flex and hyperextend, okay? I want to have them ulnar deviation, radial deviation, okay? Now I want you to rotate. Now I'm going to check strength in the wrist. So what I want you to do is push down, and I want you to pull up. Okay? Now check the strength. Push up. Push down. All right, thank you. All right. Each joint. Now I'm coming down to my fingers. I'm going to check the joints of my fingers. Any tenderness, no nodules. Okay. And both hands. And I don't have to spend a lot of time, because if they have any pain or if you feel any irregularities, you're going to feel those nodules there. And you're going to typically feel when somebody has rheumatoid arthritis. And you won't have to feel it, you'll see it, okay? All right. So now, what I want to do is check the strength and the mobility of the fingers. So I want you to make a fist, to open them up, okay, and close them. And then I'm going to take my 3 fingers, and I want you to squeeze for me. Tight. Thank you. All right. So she's got equal strength, grip strength is equal in both hands, all right? Now I'm going to do my hips and my knees, because I've got her standing up. If I had her in lying down, I would do a little bit different. Now I'll show you what I'm lying doing, but lying down also. So, but I want you just to turn around towards me. And I want you just to, hold on to the bed so that you can support you. I'm going to be on this one so we don't kick each other, all right? All right, so I want you to flex your hip, extend. So what I've done, I flexed, I've extended, all right? So I'm going to come back to normal, or neutral, and I want you to put your leg behind you, so that's hyperextension, all right? So the other one, again, flex, extend, back normal, Okay? All right, so now I've taken my hips and my knee through that range of motion, okay? Now I'm going to come across, and I'm going to do ab, back to neutral, and add, ab, and add, okay? Add and add, okay? So what I'm doing, I'm taking the hip, and then one of the last things we can do is, when we have them standing, is we can do internal rotation of the hip, external. So just rotating that foot so that you feel that rotation now. I'm going to lie you down. If you have a patient laying down, this is how you would do it. So I'm going to flex. I'm going to flex my hip. I flexed my knee. I've extended, all right? I've ab, and I've add. I'm going to bend your knee. I'm going to do internal rotation, and I'm going to do external rotation. All right? So those are the movements that I take them through. My final, as I get down to the end here, my ankles, I do dorsal flexion, plantar flexion, okay, rotate it, okay, okay, good. And then I'm going to do my plantar reflex. And you did it.
Okay.
And the plantar reflex, remember, is when I curl my toes like so, okay? You don't want them to go like this. You curl my toes like that. All right, did I do everything? This is where you always leave yourself a little bit of time and you do a mental review in your mind, okay? Because you'll turn to your evaluator and says, am I through? And they're going to look at you like they don't hear you.
How about contour?
You can't, pardon?
The contour. Like when you're checking the skin. Did you do that?
Of the abdomen?
Turgor.
Yeah.
Oh,
Turgor.
turgor.
Okay.
Always remember, you should try to leave yourself a little bit of time to go and just review in your mind what I need to do, okay? So if you forgot, then you've got, I think, said 25 minutes, right? And if you're through in 20 minutes, so be it. And if you feel like you're confident, you've covered everything, and then just say finish. But if you're not through in 25 minutes and the bell goes off, then you're through. And then you'll have to come back and do it again. So, did I forget anything?
I think so.
Ah, thank you, I did forget that.
Are we doing the
Visual
testing of
muscle.
the hand?
Oh,
Oh, yeah.
diagnosis. Okay. So facial nerve. I did forget something, see? Thank you. All right, facial nerve, I want you to raise your elbows, eyebrows, okay? And I want you to frown, okay? And I want you to push out your chin, okay? All right, okay. Okay. And then I didn't do 12. I want you to stick your tongue out, side to side. Okay, side to side out, okay? And here, okay? All right. And I want you to say light, tight, dynamite.
Light, tight, dynamite.
Okay, cool. All right?
Dynamite.
I think very few people have seen that show.
I know, I referenced that, and they're like, what? And then you said it in class, so.
Yeah. Anyway, all right, then the sterignosis and the graphesthesia. Sterignosis, I want you to close your eyes. You can sit down.
Just close your eyes.
Just close
Well,
your eyes.
I didn't want to peek.
All right, I want
I'm
you to tell me,
sneaky.
I want to tell me what that is. What?
A quarter.
Okay, cool. All right, and then I'll have different things out here so that you can test it on the other side. Graphesthesia. Let's do this one. Okay, close your eyes. Okay.
5.
Okay, good. And then see the other one?
W.
Good. All right. So that's graphesthesia.